continue with our program, we have Doctor. Good morning. Korean on issues related to absorption. Good morning, Doctor. Drug abortion is a most mentioned topic in this decade. Unlike 20 years ago, it's also one tax has become the subject of debate. Is it good to practice it? Is it laying? What consequences exist on my baby? Tell us little about abortion.
Good morning. Although it is an issue that we could say is already part of society, there are many people, especially women, who are unaware of have very little information about abortion. Abortion is the loss of pregnancy at a time when the fetus of embryo is not viable, that is not capable of surviving outside the material world. It can occur both spontaneously and induced. Whatever the case, the abortion ends with the expulsion of the fetus through the vaginal canal.
By Spanish, abortion we can that it refers to some accident or some nurse negligence that occurs during the pregnancy, mentioned as little more above the induced type.
That's how it is. Spontaneous abortion is one that does not occur intentionally, but rather due to a series of complications in the fetus of the mother. It generally occurs during the first 12 weeks of gestation and does not require any type of surgical intervention. But after the week 20, it is called fetal death. On the other hand, induced abortion is one that is performed by the woman's own will.
In the case of induced abortion, is there only surgical intervention or are there other methods for this type of practice?
There are two ways to terminate a pregnancy. One is medical abortion and the other is surgical abortion. In the case of medical abortion, medication is taken to perform the abortion. It can only be done during the first 9 weeks of pregnancy. The most common is mifepristone, a hormone that blocks progesterone, and these other drugs are taken for 3 sessions in a clinic under the supervision of a doctor, and some vaginal bleeding may occur from the drugs. For surgical abortion, surgery is done to remove the fetus. There are 2 common methods of surgical abortion: by manual vacuum aspiration, which can be done during the first 12 weeks of pregnancy and consists of removing all the tissue that contains the uterus with natural suction instrument, and dilatation and evacuation. This type of surgical abortion can be performed after the first month of pregnancy, but always before the 13th week. It also consists of removing the tissue that lines the uterus, but it's done using a machine. In both cases, the cervix is dilated and a tube is inserted through which everything to be removed is suctioned to complete the abortion. After this operation, there may be some bleeding as well as menstrual cramps.
It should be noted that all this is for information purposes. We are promoting this practice at anytime, and I think this is the part that very few women knew. The risks of having an abortion. Tell us, doctor, what are these risks?
If the abortion is performed in a certified medical center, there should be no risk beyond vaginal bleeding or menstrual cramps. The risk exists and is created when it occurs in an unauthorized place or without having the necessity conditions to carry out this practice. The main complications of an unsafe abortion are the severe bleeding, infection, peritonitis, and lesions in the vagina and uterus. There can be also be long-term consequences that affect future pregnancies, including infertility. In cases of total negligence, it could be with the end death of the person undergoing this unsafe abortion.
Remember that abortion is constantly a practice under legal debate, and if it's performed, it must be under close observation and attention by professionals in a certified medical center. Thank you very much, Doctor, for your time and for this information provided to our viewers.
Thanks for your invitation.
This bill does a really good job of protecting the most vulnerable members of our human family.
We are going to be shouting from the rooftops that abortion is still safe, legal, and accessible.
There is a heartbeat. This is a thriving, growing human person, and so we need to acknowledge that and protect that life as well.
I work as an abortion clinic escort in Huntsville, Alabama, and what we've seen is since these heartbeat bills and this legislation has started being passed across the United States, we've seen the activism and the threats from the anti-choice movement on the sidewalk ramp up.
This is part of a comprehensive and rather clever campaign by pro-life advocates. They have passed laws of different types in different states.
Good evening. In a landmark ruling, the Supreme Court today legalized abortion.
So the concern for pro-choice advocates in the country really is twofold. This is a direct assault, but it may not be the most serious threat. John Roberts could reject this, could even block it from being heard, but they could still grant review in these collateral attacks, chipping away, making it more difficult to get an abortion in various states. Roberts could very well sign off on that.